So just to make sure I got that question on there, sir, can you tell me the common name for the tibiofemoral joint?
The tibiofemoral joint. Didn't you? Was it the knee?
Yeah. Thank you, sir. Mr. Blygen. Hey, Mr. Blygen, can you tell me the common name for the talocrural joint?
Is that the ankle?
It is. Yeah. Crural comes from the crural region, and talo is the talus, which is the bone that the tibia sits on. It is the ankle. Thank you very much, sir. Mr. Brown.
Hey, Mr. T.
Hey, buddy. Hey, Mr. Brown. Can you tell me the 5 muscles that make up the anterior lateral region of the leg, kind of your shin?
Damn, I thought you were gonna give me one of the points like my knee. Anterior.
Lateral, 5 muscles.
We got the gastrocnemius.
That's posterior leg. This is
okay, anterior.
Yeah, anterior and lateral.
The fibularis.
Yes.
Longest.
Yes.
Fibularis brevis.
Yes.
The fibularis and the peroneus are the same one.
Yes.
The tibialis anterior.
Yes.
The digit flexor. Flexion happens in front. Flexor digitorum longus. And the flexor
Extensor.
but
Because something on top would pull the toes out and extend them.
Okay, yeah, the foot's different. Extensor digitorum longus and extensor hallucis longus.
Good job. Thank you, sir. That was good. That was really good. You didn't, last time I asked you that, you didn't get that right. You did really well. Good job. Thank you. Thank you, thank you. Miss Estes, what is the common name for the acetabular femoral joint?
That's the coxal joint.
Yeah, coxal, your hip. Cool. Thank you, ma'am. Miss Hawks. Miss Hawks, what? I'm trying to think of stuff right now. What is the common name for the humeral ulnar joint?
The elbow?
Yes. Thank you very much. That was awesome. Especially because I haven't said this stuff very often. Really good. Miss Carodi. Miss Carodi, did you guys start partying already? Where'd you go? Miss Carodi, I did lose you. Miss Carodi, I lost both of you. Oh my gosh, you guys are killing me. All right, hold on.
It's freezing again, the computer. I'm sorry.
Oh, that's okay. I thought maybe you'd started doing shots early or something. Miss Carodi, Miss Carodi, what would be the common name, and this might be tricky, so I completely understand, but what might be the common name for the temporal mandibular joint? If you were just telling an ordinary person, what would be the temporal mandibular joint?
TMJ.
TMJ, yes, that's the shortened version, but what is it? Can you point to it on your body? Yes, it's your jaw joint. Yeah, cool, thank you. Perfect, good, thank you, awesome. Miss Lobitz.
Yes.
Miss Lobitz, what are the 3 muscles that make up the pes and serinus insertion point?
The gracilis, sartorius, and semitendinosus.
Yeah, and roughly, you don't even have to use exact terms, but roughly where do I find that place? Like on what bone, you know?
On the knee. Well, the medial side of the knee, right?
Yes, but which bone? You're right, it's medial. You're absolutely right.
Tibia.
Yes, it's It's on the medial proximal tibia. Very good. Really good. I especially like it because you figured it out. If it didn't cross over the knee, it wouldn't make any sense. So it has to hit the tibia. That's perfect. Thank you. Really well done. Miss Mejia.
Yes, how many?
The hamstrings. The hamstrings cause a flexion of the knee. All of them do cause a flexion of the knee. There's 4 heads. There's 3 hamstrings, but there's 4 heads. All of them cause a flexion of the knee. Only 3 of them cause an extension of the hip. Which head does not cause an extension of the hip?
The short head of the biceps fingers.
Beautiful. Thank you. Thank you. Thank you. Good stuff. Mr. Placencia.
Yes.
Mr. Placencia, if I turn my torso to the right, to my right, yes, what you are doing right now, thank you. Which obliques do you use to do that?
Turning to the right, that would be, that's a bit difficult.
It is so difficult. I'm literally doing it to myself right now, so I know if you answer correctly.
So it is my right internal.
Yes. Yes.
And my left external.
Yes, very good. I literally put my hands on my stomach like this because the internals run this way, and so the right external pulls me this way, and the left the left external pulls me this way, and the right internal pulls me out. And I literally have to do that to figure it out every time. Good job. Thank you, sir. Really nicely done. Boom, boom, boom. Mr. Riedel. Mr. Riedel, what are the 5 hip adductors called that are found in your medial femoral compartment?
You got the adductor magnus, adductor brevis, the pectineus, the gracilis,
So far, you're 100% correct. You got another
yeah,
adductor you got to tell me about.
adductor brevis,
You already told me that one.
adductor longus,
Yes. So what were they again?
adductor brevis, adductor longus, adductor magnus, pectineus, gracilis.
Excellent. Which one of those is most posterior?
Magnus.
Yes, thank you, sir. And one last question. Which one of those crosses over the knee and inserts?
Gracilis.
Yes, thank you. It's been a pleasure. Awesome. Awesome. Ms. Routson. Ms. Routson. Ms. Routson. Ms. Routson. Ms. Routson. Ms. Routson, don't leave me hanging.
I'm here, sorry.
That's okay. Ms. Routson, what are the names of the quadriceps femoris group?
Rectus femoris, semitendinosus, semimembranosus.
Nope, stop. You're giving me hamstrings.
Sorry. Pain. Okay, now I'm outside. Vastus medialis, vastus intermedius, vastus lateralis.
And what was the last one? Or the first one?
Rectus femoris.
Cool. Which ones of those insert into the tibial tuberosity via the patella and the patellar tendon and ligament?
All 4.
Yes. Which
Yes.
one or ones of those create an extension of the knee?
Rectus femoris. All four of them.
Yes. If all four insert in the tibia, all four create an extension of the knee. Good. Which one or ones of those create a flexion of the hip?
Rectus femoris.
Yes. Which one or ones of those can create an anterior tilt of the hip?
Rectus femoris.
Yes, because the flexion of the hip is an anterior tilt of the hip. Thank you very much, ma'am.
Yep.
I'm loving it. Miss Sarno.
Yeah.
I forgot what I was going to ask you. Bear with me 1 second. Oh, yes. There are two muscles that both have attachments. They both have attachments. One's an origin, one's an insertion, but there's two muscles that both have attachments on the acromion process, the spine of the scapula, and the lateral 1/3 of the clavicle. What are those two muscles? Lateral 1/3 of the clavicle, acromion process, spine of the scapula. There are two muscles that share that place as an attachment site. For one, it's an insertion. For the other one, it's an origin, but they both connect there.
Trapezius and
That is 100% correct.
major.
Trapezius. So you're right about my trapezius. What happened? Where does it go down here?
Deltoid.
Yes! The trapezius and the deltoid share attachment sites. Yeah. Very good. By the way, all of this is to get you guys ready for the test. So they're not random questions. They're important ones. Yeah. And that's actually why the shoulder girdle complex kind of works as a unit. When I lift my arm up, my trapezius actually starts to rotate this up and my deltoid brings my arm up. There's actually two actions happening here. Otherwise, I would move like this. But I don't. So yeah, the trapezius and deltoid, good job. That was a really hard question. Thank you. I really mean that. I think they're really hard. Okay, Mr. Tate.
Yes.
I have a couple questions for you to review from yesterday. If I say latissimus dorsi, you say?
Latissimus dorsi, I say teres major.
Yes, sir, you do. Good job. If I say infraspinatus, you say?
Infraspinatus. Infraspinatus. I say teres minor.
Yes, sir. Thank you for that. Okay, sir. I had another question to ask you, though.
Yes.
And, oh, yeah, what are the three muscles that make up the erector spinae group? The spinal erectors.
The spinalis.
Yep.
The longissimus.
Yep.
And the iliopsoas.
Excellent. Can you name them for me from lateral to medial?
There's an abbreviation for this, right? So
There might be, I don't know.
not abbreviation, but like an acronym.
Maybe.
So it's the,
I like spaghetti.
I like spaghetti. So the iliocostalis, the iliocostalis, the latissimus, and then the spinalis.
The latissimus. What muscle is that?
The longissimus.
Yeah, good. So what was it? What was it again, sir? From lateral to medial?
The longissimus, the iliocostalis, and the spinalis.
Yes.
I
Oh, wait,
like
no.
I like spaghetti is I. Iliocostalis.
Yes.
L. Tongue twisters. Latissimus.
Longissimus?
Longissimus. Fuck me. I'm sorry.
No, it's okay. But try not to say that.
Spinalis.
Yes, it's spinalis.
Longissimus. I'm sorry.
It's okay. So the way I remember it, by the way, I don't know if this helps, but the spinalis attaches right to the spine, so it's most medial.
Yeah.
Iliocostalis is most lateral because it really means your hip rib muscle. Costals are your ribs that are out on the side, and ilio is the crest of the ilium, so it's your hip rib thing. So that's how I can remember.
I was thinking that the longissimus was the most lateral as well because it starts with an L and it reminds me. It sounds like the lats, which are on the lateral side of the muscle.
But it's not. It's not. What's significant about the longissimus is it inserts into the mastoid process of the temporal bone, and it's in the middle of those two. Yeah. So it really goes.
I like video. Fuck me again.
Stop. Spinalis. Thank God it's not a high school class. Longissimus iliocostalis. All right. So what are the three spinal erectors from medial to lateral?
Spinalis. The spinalis. The longissimus, and then iliocostalis.
Good job. Thank you, sir. Thank you. Oh, woo. Yes, Miss Lobich. Yes.
Another thing I remember Mr. Ibarra saying is that iliocostalis lives on the coast. So you got your body is like a coastline, and
I love that. That's
it's
beautiful.
on the coast.
Another
Yeah.
way to look at it. Yeah. I love that. Good old Mr. Ibarra. Man, guy's amazing. All right, Miss Trotter.
Yes.
Miss Trotter. Hold on. All right, I got one for you, Miss Trotter. Which calf muscle only plantar flexes the foot and does not flex the knee? Which calf muscle only plantar flexes the foot but does not flex the knee?
Soleus?
Yes, soleus. The gastrocnemius goes across the knee also, and believe it or not, the plantaris goes across the knee too. It's a tiny little muscle, but it does go across the knee too.
Yeah, I was just thinking plantaris because you're planting your foot.
No. I understood where you're going with it. I got the guess. But yes, the soleus, also soleus does is plantar flex your foot. Kind of like my brachialis just flexes my elbow. It doesn't do anything else, whereas the biceps brachii is kind of like the gastrocnemius and does multiple things. Yeah. Very good. Thank you, ma'am. Trying to get you guys used to the style of questions you might get at some point, you know. Anyway, Miss Vincent.
Yes.
Miss Vincent, this one's tough, ma'am. It really is. Hold on a second. 1, 2. Yeah. What are the four muscles that attach to the medial border of the scapula?
The medial border. Okay. We have the serratus anterior
Yes.
attaches there.
Yes. That's
Infraspinatus attaches there.
no.
No.
You're right. It's on the scapula, by the way. You're not far off.
Yep. Subscapularis.
Nope. Yeah, it's on the scapula too. All the rotator cuff muscles actually take the scapula and attach it to your arm.
Okay.
This
All
one,
right.
yeah, we're looking at just the medial border of the scapula, right between my little wings here. You're right about serratus anterior.
Anterior, levator scapula, rhomboids minor, rhomboids major.
Thank you. Awesome. Good job. Really good job. Hard question. Good job. Thank you. Miss Walker T.
Yes, Mr. Chestnut.
Miss Walker T, one of the skills that we use when we're a massage therapist and somebody comes in with a tight joint or whatever is just to work every single muscle that goes across that joint. And so, can you name for me all the muscles that cross over and therefore can move or make tight or whatever, but I don't care. All the muscles that cross over the glenohumeral joint. And first tell everybody what the glenohumeral joint is to make sure.
The glenohumeral joint is the shoulder joint.
Yeah, so we are looking for stuff that starts somewhere over here and gets somewhere over there. Yeah, and there's a lot.
Okay,
So I'm going to start with latissimus dorsi, teres major, teres minor, infraspinatus, supraspinatus, subscapularis, shoulder joint, pectoralis minor, pectoralis major.
Stop.
Bicep,
Stop. You're doing great.
bicep.
You're doing great, but pectoralis minor does not cross over the shoulder joint. It does not move the humerus.
No, it doesn't.
Yeah. But pectoralis major does. You're on a roll.
Scapula. The biceps brachii crosses over the shoulder. The cora.
Yes. Coracobrachialis.
Coracobrachialis
Yep.
crosses over, and the long head of the tricep. Well, would that technically cross over?
Yes. No, it does. It technically crosses over.
Kind of.
Yeah. Not kind of. It really does. It gets from one bone to another, and that's crossing over. And it can affect movement in your glenohumeral joint. Truly. Yeah. Did you say deltoids?
No.
Okay. And deltoids. That was the easy one. Deltoids, the easy one. Really good. So I think she just listed off like 11 muscles that go across that joint. That's awesome. Thank you, ma'am. Miss Walker, why?
Yes.
Miss Walker, why? What are the name of the pectoral muscles again?
Pectoralis major and minor.
Yeah, that's right. Which one's more superficial?
The minor. Major.
Yeah, major's on top. It's actually what gives you shape to your chest. Minor's underneath. That's why we can't see its little three prongs. So the minor is deep. The major is superficial. Which one moves my scapulothoracic joint?
We went over this yesterday. I want to say it's the major.
Yeah, I really want you to say it's the minor. But that's okay. I'll keep asking you until you tell me minor. Which one crosses over the glenohumeral joint, inserts into my humerus?
Moves the arm.
Yes, moves the arm. Which one is it?
This is me guessing because I keep forgetting.
It's okay.
I want to say minor.
I want you to say major. I'm going to draw you a picture. By the way, I'm not trying to pick on you. You're right. I keep asking you because I just mark down what people get wrong, and I just keep asking. Don't worry about it at all. This is your area of being stuck, so don't worry about it. All right. This is good for everybody, though. Can you guys see this? I hope. Good. Let's make a body. And here's a tummy. Here's some legs. All right. You have scapulas. And like this. And you've got an arm coming off them. Right? And there's this weird little hook up here that actually pokes through in front, up here in front of my body here, right? I'm just trying to get a different color. You can see though. The pec minor does this. Attaches to the coracoid process and hooks to my ribs. So all it can do is pull on my scapula. The pec major, in a different color, actually goes over to my arm, like this. So the pec major really jumps over this joint here and actually moves my arm for like push-ups and all sorts of stuff, by the way, because it's got fibers. It can actually help me lift my arm and pull it down, all sorts of stuff. But the pec major goes over here. The pec minor never jumps over the scap. It only grabs on the scapula. I don't know if that helps, but I hope it did.
Yeah.
All right. All right. Sorry. Thank you, ma'am.
Thank you.
pretty good chance I'll ask you that again tomorrow.
Okay. Okay.
Thank you. Miss Zhong. Miss Zhong.
Hi.
Hi. Hi, Miss Zhong.
Yeah, hi.
Okay, Miss Zhong, what are the 3 calf muscles?
So yes. Fast, plantar.
Yes! Awesome. What are the 3 hamstring muscles? That's good. Good. What are the 3? Oh, I'm not done yet. What are the 3 gluteal muscles? Beautiful. What are the 3 erector spinae muscles, spinal erector muscles? What? Good. Iliocostal. Can you say it one more time? I'm sorry. One more time. Yes. Yes. Good. Okay, sorry. A couple more. What are the 5 abdominal muscles found in my tummy all around here? Yes. Rectus. Yes. 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 Okay, just a couple more. What are the 4 quadricep muscles that you find on your thigh? Yes. Vastus lateralis. Good. All right, last question. What are the 5 inner thigh muscles inside your leg here? The medial forearm part. 5 muscles. Adductors. Yes. Magnus. Yeah. Adductor magnus. Yes. Adductor longus. Yes. Yes. Pectineus. Yes. That one's hard. Gracilis. Yeah. Yeah, that was good. Gracilis. Yay! Thank you. Thank you. Oh, all right. Good stuff. All right, everybody. Let's take a 15-minute break here before we start talking about TMJ and stuff. I want to split the 2 things up. I know it's early. Bear with me. But we'll come back at 4:21. Yeah? Did you have a question, Ms. Trotter? I saw you doing this with your hand.
Yeah.
Yeah.
I was gonna see if you can explain the internal and external, like obliques a little bit more? The question you asked,
Yeah.
Cynthia?
Yeah, let's not go on break yet. We'll still take a 15-minute break. Let's do this really quick because I can show you visually here and it will really help. Really help. Okay. So I think this will fix it, but you've got to remember about the hands. So first, hold on, don't ignore this tape, I gotta hold it. What oblique are my hands signifying right now?
Isn't that the internal?
No, this is external.
Oh, wait.
So here's how I remember, but now if I switch my hands and go like this so they're kind of inside each other, then that would be internal. Okay? So that's really important right there, and don't worry, we can do this every day if you want. Like, that's what we're doing right now. But so if I put a long line, a yellow line going like this, oblique means diagonal. Which abdominals is this signifying?
Internal? External?
Yes, these are external. Because look at how my hand
Yeah.
goes on. That's important. Okay. So then you'll notice if I do this one, if I did my hands inside, that way, right? Okay. So let's look at just external, and then we'll talk about internal. External goes like this, right? If I reached over here and started to pull, what would happen?
You go.
Yes. So if this side starts to pull, I actually rotate away from it.
Yeah.
So, I mean, some people memorize this, but I don't like memorizing stuff like this. I'd actually really, but you could. So the external obliques, when they work to the opposite side. If this side pulls, and so by the way, when you're rotating, it's never both external obliques or both internal obliques work at the same time. When both work at the same time, because they're going diagonal, they actually make me crunch. So it's either this side pulling me to the opposite side or this side pulling me to the opposite side, right? But the tricky part is usually the internal oblique is doing the exact opposite. And we love this question in anatomy because it really shows if you can actually visualize muscles and stuff, which is why it's so darn hard. And the good news is I suspect if you ask this, 95% of massage therapists out there could not answer this question. So you will be way ahead of them. So, first, which abdominals is this?
Internal.
Yes, because if I put my hands here like this, they run diagonal down. So if this muscle contracted, can you see that it would pull me to the same side?
Yeah.
So here's the other cool thing. This is what I love the most. And I think it'll help a lot. Which muscle is this?
External.
Yep. Which one is this?
Internal.
Do you see that they are parallel lines?
Yeah.
So they are, that's why it works the way it does. They are both going to pull me over there. So the external oblique and the internal oblique work together on opposite sides to pull me over because they're both running the same direction. The external oblique on my right side runs the same direction as the internal oblique on my left side. And so the answer to the question is, if I'm turning to the left, the question I asked was to the right, but if I'm turning to the left, my right external oblique and my left internal oblique are what turn me. Now, I don't care if you do, I get the feeling you get the concept at least. Good. So we might need to review it again and do it on yourself, things like that, but you at least can kind of see how that's happening, like this pulls. Cool. Good. That's really good. Okay.
And then for like the hand movements, because I know like you do like the rectus abdominis and the transverse abdominis, and then I always thought it was internal obliques and the external obliques.
Yeah.
Maybe that's maybe where I'm getting confused.
I think that might be it. So I always think like rectus abdominis, transverse abdominis, external obliques, internal, look at my hands, internal obliques. Quadratus lumborum. And as silly as it sounds when I'm talking to you guys about it, I'm actually thinking about that, even if I'm not moving my hands. I literally am thinking like, because this is about the size of quadratus lumborum. This is what the rectus femoris does. This is where the external obliques are. This is the internal, all that stuff, yeah. Good question, thank you. Thank you. All right, everybody, now we can come back at 4:26. So I will see you all then, 4:26. Okay, everybody. Welcome back. Yeah. Hi. Hello. Hi, Miss Cerno. Miss Lopez. Hi, Miss Trotter. Hi, Miss Crody. Hi, Miss Song. Hi, Miss Estes. Hi, Miss Rodson. Sneak attack kisses. It's always a good thing. Hey, Mr. Tate, you there, sir? Mr. Tate. Mr. Tate, you there? Mr. Blygen, you there?
I'm here.
All right, cool. Mr. Brown, you there?
Yes.
Awesome. Miss Walker, are you with us? Miss Walker, why? Sorry. Should have been
Yeah.
Thank you, ma'am.
Yep.
Mr. Tate, are you there? Talk to me.
Yes, sir. I'm here.
Oh, good. All right. Okay, thank you, sir. Mr. Placencia, you there?
I'm here.
Awesome, thank you, sir. And Miss Allure, are you there?
I'm here.
Thank you, ma'am. Okay, everybody. Let's talk about temporal mandibular joint, which is your jaw joint. And we're going to talk about the muscles that affect your jaw joint. TMJ is a major problem, and lots of people suffer from it. It can be caused by all sorts of things. It can be an arthritic condition, but it is very much so, can also be strictly a tension condition that causes all sorts of problems. Human jaws are very weird. We think that they just do this, but they don't. They actually have the ability to kind of come down and out and back in as they open up. And so it's a very complex hinge joint that can actually come out and back in. And because of that, it can get out of joint here. You probably all have caught your jaw once at some point in your life where you've kind of felt it like kind of lock up a little bit and it pop back in. So that is just an example of some of the problems that can happen with your jaw joint. And so we're going to talk about 4 muscles today that directly affect the temporal mandibular joint. So let me share this presentation with you. You will have a client come in. You will definitely have a client come in with temporal mandibular joint syndrome or complaining of symptoms of that. All right, let's see what we got here. Okay, let's look at the side of the skull here. This is your temporalis muscle. And your temporalis muscle, I know it doesn't look like it from the picture, but it even feeds into the fascia of the Gallia aponeurosis or aponeurotica. This temporalis muscle actually goes under your zygomatic arch, which is made up of your zygomatic bone and the zygomatic process that comes off the, lo and behold, temporal bone. Those two make up your cheekbone, and the temporalis actually goes underneath it and inserts into your jaw. I will show you a better picture here in a minute, but that is why when you chew your jaw like this, you can actually feel the muscles up here, not just down here. That is your temporalis you are feeling moving up there. Down here, kind of in your cheeks, is your masseter that you are feeling. We'll also learn about 2 other muscles that are underneath essentially the masseter that are called the pterygoids. that can have a lot to do with TMJ problems. So we will do that as well. Boom. Actually, that's not a bad picture. Hold on. No, it's not great. We'll see if we got something better. Let's look at the masseter first. It's actually really hard to determine this stuff, but some people call the masseter, pound for pound, the strongest muscle in your body. Your masseters can apply with your jaw about 300 foot-pounds of force. That is enough to bite off a finger, right through the ligaments and everything. Just good to know in case you're hungry. Anyway, the masseter actually has two bellies. It's got kind of an external and internal belly. That's not so important because to us they feel like one muscle because they're right on top of each other. But it's extremely strong. Its origin is on the zygomatic arch. So if you all touch your cheekbones right now, if you find your cheekbones and just fall off them, the minute you fall off them, you're on the origin of the masseter. It's right here. And it can take a lot of force. You can, it makes your eyes roll back in your head, but you can really push in your masseter and slowly rub it all the way down till it actually inserts into what they say is the ramus of your mandible, but it's your jaw. The ramus is just the arm. It just means this thing, but it comes all the way down to the edge of your mandible. So it really hooks the zygomatic arch, your cheekbone, to your jaw. And it is your main chewing muscle. There's no doubt about it. That's where the power comes from. And lots of clients have tension here from grinding their teeth at night, tension, all sorts of stuff like that. Super powerful. Can be rubbed super hard. One of the most effective things for temporal mandibular joint syndrome, by the way, is to rub these stuff really slowly. So this is true myofascial work. Myofascial work, the speed that your stroke is the speed their tissue allows you to go. So you'll sink in here, and I will let my thumbs go down when they go down. As the tissue slowly lets go, they slowly go down. And this is fast. Sometimes you're spending 10 minutes just letting them, kind of the tissue kind of give way. Super effective though, and there's not a lot of stuff that's effective for temporal mandibular joint syndrome. So massage is a really good way to go. That's the masseter. Yay, masseter. Completely palpatable, it's superficial. In this picture here, you can see the origin here in this black line underneath the zygomatic arch. And here's the insertions all along the ramus of the mandible, right here. Super powerful. If you're working on this with somebody who has TMJ syndrome, make sure you're using very little oil. You don't want to irritate their face, so you might have a tiny bit, but I'm literally talking a drop, literally one drop. And most people, if it's really serious, we do all this work dry. So that's the masseter. Here's the temporalis. Now remember, this picture has the masseter not in it, because you wouldn't be able to see some of this stuff if it was. The temporalis hooks into it has an origin on the temporal fossa and fascia. Temporal fossa is just this slight indentation in your head that you can't feel because there's a muscle on top of it, and the fascia here. Yeah, and that's really a way of saying it sews into the fascia of your head. So your temporalis can tie into your gallia apnerotica. All this stuff ties in together here. This is one big fascial web. So when I'm working on people with TMJ stuff, I'm going to hit these four muscles that we're going to talk about today, but I'm also going to loosen up their entire skull. I'm going to work the one muscle that's the occipital frontalis all the way back here, and I'm going to hit neck and shoulders heavily because it all ties into jaw tension. We know that, and it makes a huge difference. So I'm going to kind of work them from here up, front and back, hardcore. And then, of course, lots of actual jaw work. But don't think it's all just in the jaw. A lot of this tension related. Anyway, this this temporalis muscle actually inserts in the jaw up front here. So it helps to pull your jaw back in after it protracts. We're going to learn about some muscles that actually help your jaw protract to move out. It helps pull it back in and elevate it. So it is a very important chewing muscle. It's a very important alignment muscle. And tension up here can really mess off jaw alignment. Because if it's pulling improperly, it can help it can make it recess improperly. It can pop in and out of that joint. So the temporalis, super important as well. And superficial, highly palpatable, until it disappears underneath the zygomatic arch. And then it's hidden, its actual insertion is hidden in behind the masseter. But the 90% of the muscle is here and it's palpatable. So easy muscle to get. It really responds well to very slow stroking too, if you're really trying to make a difference with it. So that's the temporalis. Origin is on the in the temporal fossa, and insertion is into the coronoid process, which is a process on your mandible that you can see clearly in this picture. Very easy to rub. Where his finger is on this second picture, it would be over the masseter at this point. So you'd be going through the masseter to try to get through this thing. And you can, but they have to be kind of relaxed, and you're trying to get down in there. It helps if their mouth is slightly open. If you open your mouth a little bit, you can sometimes feel the coronoid process in there if you play with this. And you will sometimes ask clients with TMJ to move their jaw a little bit, just a little bit, so that you can kind of get some action in here. It should be sensitive and should feel weird and thick and all sorts of strange stuff. Okay. Then we got the pterygoids. It looks like they're spelled pterygoid, but they are pronounced, the P is silent, they are pronounced pterygoids. And there is a medial and a lateral pterygoid. The medial one can really only be reached by reaching inside the mouth. I will show you some a skull here in a second that will give you a much better idea of this. But what's very important about this is that they can create problems with lateral deviation, which is when my jaw goes to one side or the other. They can protract my jaw, which is to pull it out. Well, the only problem with that is that eventually you're pulling it out of joint. And so if they're tight, I can be in a protracted state or a laterally deviated state. And it doesn't take much to really irritate this joint after a while. So the muscles are supposed to do that, but if they stay tight, I can stay in a protracted state or a laterally deviated state, and that causes joint problems. And it's really hard to avoid using your jaw if you want to eat or talk. So when I am dealing with muscles of the temporal mandibular joint, yes, I really care about the masseter. That one's easy to find. But I tend to really focus on the temporal muscle and the pterygoids. Let me get to the next pterygoid. The next pterygoid is found underneath the masseter also. And it's right underneath your zygomatic arch, but underneath the masseter too. And if you'll look at this picture, here's what's significant about it. It too can actually pull and protract, pull the jaw out of joint. It's meant to kind of protract a little bit when I bite. But if it's tight, it can laterally deviate and it can protract too. Now I know this is very hard to see, so I'm going to show you something different. Bear with me here a second. Let's take, this jaw does not have actually a lateral pterygoid, but it can show you where. Here is a jaw, right? This is the masseter. I'm going to take that off. It's kind of two-bellied, actually hooks up under here. This is where the lateral pterygoid would be, right in here. Let me take the temporal muscle out. It's going to come, it was hooking down up here, right? It comes out of there too. And like I said, the lateral pterygoid would be right there. This model doesn't have it. They didn't have space to put it in. but I can show you the medial pterygoid in here. The medial pterygoid is back in there on both sides. The only way to get to the medial pterygoid is to actually reach inside a client's mouth, and you can't do it from underneath. You actually have to have a mouth open, have a gloved hand, and reach back in there, in towards the jaw joint itself, and push on that. It's very intense, very personal work. I don't usually go after this sucker unless I absolutely have to. I try everything else first. Yes, Miss Walker.
So does that mean that I'm trying to make sure I'm talking about the lateral pterygoid, does that mean that you can't really rub it since it's like under the master, under the...
Yeah. I think you can rub it in the sense that you can press hard enough to go through the master and get to it. Does that make sense? You can affect it. The lateral one's not the big deal. It's the medial one. But you're right. You'll never touch the lateral one directly. And the medial one, you can get in there directly on it. Yeah. You're absolutely right.
And then I can't remember what it's called, but there's some sort of gland or something kind of over the masseter. I don't know if we talked about that.
You've got some glands right below it that are really sensitive on people and kind of make them cough. But you're not going to hit anything if you're up underneath this cheekbone here. There are some little ones right around the corner here, but they're down on the bone. I don't think it's going to cause you a problem.
So we're not really massaging through any glands to get to the masseter.
No.
Okay.
No, you're not. And my experience has been that these muscles are very important, but they are not the singular cause of most people's TMJ. So I'm not like, somebody doesn't walk in and I'm not like gloving up right away because I'm like, we're going to go into your mouth. Quite often, it is a tension-related problem to begin with, and general massage already helps. And so I'm doing lots of neck and shoulder work, lots of stuff to loosen up the tension here, lots of head work, and then I hit the temporalis, and then I hit the masseter, and then I make sure that when I hit the masseter, I dive in right below this bone and have them move their jaw so that I can get into the lateral pterygoid, and usually that's enough to cause stuff to kind of get better instead of me sticking my hand inside their mouth. I'm not against that. It just, there are very few problems in this world in a massage sense that you find one muscle and work it and they just go away. And so I'm not like, oh my gosh, if we don't get that one muscle, it's not going to work. Quite often it's the combination of tension in all these areas. When you kind of get them loosened up, things kind of get better. Yes, Ms. Walker.
No, sorry, I forgot to turn my hand off.
Oh, okay. No, it's completely okay. Yeah. So, yes, Mr. Brown, please.
So I got a little sidetracked. Was this talk about massaging the inside of people's mouth?
How long were you gone? The medial pterygoid is a jaw muscle that can only be reached from inside the mouth. Yeah. And so if you had to get to it, that's where you would go. I would not even, this is for a client that comes to you for temporal mandibular joint syndrome. They're in pain and that's what they want. You know what I mean? Yeah. Let me see here too, if you guys will bear with me a second. I want to see if I might have a slide for you guys that's a little bit, hold on, bear with me. Let's see if I have a slide on. Let's go see if I had a, oh shoot. Bear with me. Let's see. Let's see if I have a kind of a better picture. Yeah, this is what I want. Sorry, guys. Hold on. I want to pull something up for you to see if I can. All right. Let's do that. Good. Okay. All right, let me show you one other thing here. Current slide. There we go. Here's the other thing that's kind of interesting about the pterygoids. Let me present this to you. It's hard to completely tell, but you've got a little cartilage plate here, and this joint here has a joint capsule around it. It is a synovial joint. Well, this lateral pterygoid here actually attaches to the joint capsule. So it can actually pull on the joint capsule when it's tight. And in some ways it can kind of pinch itself. It can pull on all this tissue, and there's nerves in here too, and it can kind of pinch itself. So it can cause some reciprocal problems, where the tighter it gets, the more it kind of pulls on itself and pulls on that joint capsule and causes irritation here and causes some of the problems that you see in here. It's a very tricky little area. And then what happens is this thing pops out, it starts to rub on its own joint capsule and its own tendon. It actually rubs, if this bone comes out, it rubs on the tendon of the lateral pterygoid. And when you pinch on a tendon, muscles tend to tense up. And when this muscle tenses up, it pulls the jaw out more and it pinches on the tendon more. So getting this to all relax can really, really help temporal mandibular joint syndrome. The idea is we are trying to calm all this down so this thing falls back into place and the inflammation goes away. It won't fix it overnight, and things tend to get better at that point. That's the approach to TMJ. The approach to TMJ is to work all four of those muscles, to work the hell out of the head, neck, shoulders, upper chest, and I really mean work them, because you are trying to relieve enough to get minute changes in the jaw. The good news about TMJ syndrome is it took a very minute movement here to irritate it. If you can get stuff to loosen up enough that it goes back a millimeter, you probably have fixed it. And then when it calms down and it quits clicking on them and it quits causing all that problems, it'll be okay. So massage really can, we're not supposed to say we can heal, but massage can greatly alleviate temporal mandibular joint syndrome. Greatly. They used to do surgery on this. It was so unsuccessful that most surgeons recommend you do not do it. It just doesn't work very well, because when you go into that area and mess with that joint, it just creates scar tissue and it just gets worse. Yeah? So massage really is the only known treatment that's for TMJ, really. Yes, Ms. Sarno, please.
If they get the surgery out there and it causes sometimes the ear cannot hear and
Yes.
with they connect with the eye also.
Yes. So whether they get the surgery, you're absolutely right about the surgery. Sometimes they have those other problems afterwards. But some of the symptoms of temporal, and remember, we're not there to diagnose when a client comes to us. We just go, okay, it sounds this way, I'm going to work on this tension. But some of the symptoms of TMJ syndrome, which you can also develop from getting the surgery too, you're right, are obviously pain in the jaw, painful clicking in the jaw, headaches, problems with vision. People with TMJ syndrome often have problems focusing their eyes because of the tension that's causing the tension around their eyes. They get ringing in their ears, problems with hearing, toothache sensations, obviously problems sleeping, all that kind of stuff too. So it causes all sorts of stuff up here, or all sorts of stuff up here caused it. That is possible too. But it's very much a tension-related problem in that sense. You can have arthritic stuff that can cause it too, but tension always makes it much worse, and relieving the tension on this one can make it much better. I love doing TMJ work because I'm sitting down at a table playing with the real tiny intricacies of somebody's head and neck and their face and all that kind of stuff. I think it's fascinating. I love it when a client comes in and they're like, I want you to spend the whole time on this problem. And I spend an hour from here up, front and back. I'd spend 2 hours if they gave it to me. And I have no problem doing that. You know, you can spend 30 minutes just working on this stuff right here. But definitely another 30 minutes on head, neck, and shoulders and such. Yeah.
I have someone like I know they brother or some that they talk about they have the problem with the ear and the eye in this from what we talk about.
Yeah, it's super common. Yeah, they have problems with their ears and their eyes. Yeah, super common.
And after that, they can see but not clearly. And they hear and just like off.
Yeah, because it's called the temporal mandibular joint, and your temporalis. What's in your temporalis? Your external auditory meatus. It's your ear hole. That thing gets shifted around. It actually connects to your cheekbone, which is the bottom of your eye socket, and it affects all these muscles in here. It's super duper big problem. By the way, what we don't know though, and be very careful about, is we don't know if TMJ causes all those other symptoms or those symptoms cause TMJ. Right? We don't know which came first, and I actually suspect it might be a general tension issue, which is why we work on all this stuff. But it works. Yeah, it's a really good approach to take. Yes.
And I have the friend. Sometimes they just this one side just keep like all the time that like they open up like this. But I don't know. I think we'll call with the TMG or TMJ.
Yeah, TMJ.
And like if this they not work, they just like tight.
Yeah.
Tight.
Super tight. Usually when you feel it's like a rock in here. Yeah.
Yes, like a rock. And after that, they just pull up and up, vibrate. Yeah. Just one side.
Yeah, that's the real problem, is when one side gets tight, now the jaw is laterally deviated and it's off, and that's really causing a problem. And quite often, people get TMJ problems in just one side. You're right.
And the jaw to be like an angle.
Yeah, that's right. And usually the idea is, because the way it's pulling, if it's laterally deviating, you work the opposite side. If my jaw's going to this side, the problem is quite often over here. So you work, if the jaw's going to the left, you work the right side. If the jaw's going to the right, you work the left side. To try to loosen that up, because that's what's pulling it in that direction. Miss Walker T, you have your hand raised.
When you're working TMJ in your experience, do you find it better to start with like the head and neck and then move to those mastication muscles?
Yeah, I do, but I don't know if I have proof of that, but that's what I always do. I think the reason I do it too is people like head and neck work, right? And this stuff starts getting kind of intense in the jaw and the face, and I want them to see how much relief they got from the head and neck work before I kind of head down to those more articulate areas. And by the time I'm down here, I'm asking them to open and close their jaw. And I also stick my fingers inside their ears. And I'll show you guys why. Yes, and you can do it to yourself here. But anyway, yes, Miss Walker, I start out with the general big stuff and work to the more focused stuff. I'll show you guys why I do it. It's very effective too. I prefer this even going in the mouth. Look at the external auditory meatus here. You can put your finger right here, and you can actually use it to massage and loosen up the tendon back here and the ligament back here, which helps to loosen up this whole joint too. And you literally, if you try it right now, if you put your fingers in your ears and open and close your jaw, you'll feel your jaw joint. And so you can actually take your fingers and wiggle it in there and actually kind of get in the jaw joint. If you kind of pull forward, pull anteriorly, you should be able to feel, kind of lift your fingers up superiorly and anteriorly, up and forward. Yep, and then I'll rotate them in there. You gotta have really short nails because you'll scrape them on the inside of their ear. And then you have them slowly and tinily, I can't even believe I said that, but anyway, minor, small movements, open and close their jaw, just like you're opening that up. And I will rotate my fingers in there. Yeah. It's very effective. Sounds strange, but it's very effective. And most people are cool with that. Although I do ask them. If I'm going to put my finger inside your ear, I'm going to ask you. And I explain to them, too, I'm talking about that much. And I'm always like, if you raise a finger, I'll stop. I'm only putting them in like this tiny little amount. But once they're in there, raise them up superiorly, anteriorly, and then kind of work in there.
The auricularis.
What?
The auricularis.
Yeah. Sorry, Mr. Bars.
He's chiming in.
Chiming in. Yeah.
And Mr. Tapscott,
Yes,
just
ma'am.
because I want to make sure I'm not reading the picture wrong, because I've done that sometimes. The gland I was talking about is the parotid gland.
Don't know it. That doesn't. By the way, I could be wrong. What's it called again?
The parotid, I don't know if I'm saying it right, Parotid, says it's a salivary gland.
There is a salivary gland around there, but I wouldn't think we'd hit it. Hold on. I'm looking it up, honestly.
Says it's located in front of the earlobe, superficial.
Yeah, it's good. Okay. So, this is the one I'm kind of talking about that people hit below the jaw. It's really, this gland is really, can you find the angle of your mandible? So this kind of back part here, there's an angle. If you push in right there, that's where you're hitting that gland. And that's where it'll bother people. You won't have any problem rubbing the masseter. But back here on some people, if you hit it, it makes them cough. And it's not pleasant. Especially if you're behind this arm of the mandible. But I'm not on the bone anymore. I'm right behind the bone. You guys should feel it should not feel pleasant. It feels kind of weird. So anyway, Miss Walker, yeah, I know what you're talking about, but you're definitely not damaging the gland by rubbing down the mandible there. And that gland where it's poking out is really behind the jaw. So as long as you're on the bone and on the masseter, you're okay.
Okay.
Yeah. I'm looking at other pictures too. Yeah. Yeah, I don't think you have a problem with it. I see a lot of representation of this gland. But anyway, you're fine. Rub it. Go on it. Yep. Do it.
I mean, I just wanted to make sure it wasn't like the thyroid gland, because I know we're not supposed to, go deep into that or anything.
Of course. I'm not saying you don't bump up against this thing, but there's no danger whatsoever. You're fine. If you're on the masseter, if you're on the jawbone, you're fine. You're fine. Completely. And I'm also saying that from doing it like a lot. With no swelling, no repercussions, no nothing. A lot. And deep. So yeah, do not worry about it. And it's not, you're right, it's not like the thyroid gland. It should be really severe. Okay. Do you guys have questions for me? No? Maybe not? Kind of, sort of? Maybe? I don't know. Well, I have questions for you. So there. Yeah, I know you're excited. Miss Estes, what is the name for the jaw joint? Miss Estes. Miss Estes, are you there? Miss Vincent, what is the name for the jaw joint?
TMJ.
Thank you. What does TMJ stand for?
Oh God. Temporal masseter.
Mandibular.
Mandibular. Joint.
Yeah, yeah. And you're right, the master runs over it. Thank you. Thank you, thank you. Miss Walker, why? Miss Walker, why? Miss Estes. Okay. Miss Hawks.
Yes.
I'll come back to you, Miss Walker. I saw you chime in there. Miss Hawks, can you name one of the 4 muscles we learned today?
The masseter, was that new today?
Yep, that was new
The
today.
pterygoids.
Yeah.
learned yesterday.
Well, you named 3. You only need to name 1, but that's good. Cool. Master, we'll take it. Thank you. Miss Walker. Miss Walker, why? Thank you. Miss Walker,
Yes.
why? Can you name another muscle we learned today besides the masseter?
I know we talked about the temporalis.
Yes. Good. Good. Wow. You guys are scaring me. But yes, we did. Temporalis and masseter. That's good. Cool. Miss Trotter. Hi, Miss
Yes.
Trotter. Miss Trotter, we learned about the temporalis today and the master and what other 2 muscles?
It begins with a P, but it's
Yeah, that's good though. You're right, the P is silent.
the tresor. No,
No, but it's all right. Good. Pterygoids.
pterygoids.
Medial and lateral pterygoids. Cool.
Yeah, because the one is like super tiny, it's like right there, and the other one's like pretty much your cheekbone.
Yeah.
You can massage inside.
Thank you. I prefer that over even knowing the name. Awesome. Thank you. Thank you. Thank you. Hey, Miss Routson.
Yes.
Hi, Miss Routson. What were the 4 muscles that we discussed today?
Temporalis, the
Yes.
pterygoids,
Yes.
the masseter.
That's it. Done. Good job. There's a medial and lateral pterygoid, so that's it. Good. Thank you, ma'am. Mr. Riedel.
Yes.
Mr. Riedel, what are the 4 muscles we learned today?
The masseter, the temporalis, and the pterygoids.
Perfect. Thank you, sir. Thank you. So, Mr. Placencia, if a test question asked you what muscles affect the movement of the temporal mandibular joint, your answer would be?
Answer would be the pterygoids, temporalis, and the
The one that helps you to masticate.
masseter.
Masseter. Good. Good job. Awesome. Thank you, sir. And that's a very common type of test question, by the way, is like, what muscles affect this joint, right? What muscles go across this joint? So I asked Ms. Walker T that today where she described all the muscles that went across there. This one's simpler, but there are 4 muscles that directly move the temporal mandibular joint. And that is the masseter, right? The temporalis, the lateral pterygoid, and the medial pterygoid. Those 4 muscles affect the temporal mandibular joint. Now, we know that tension in this area affects this problem here too, but I'm talking about things that move my jaw that I am using right now to speak to you. Those 4 muscles are working on both sides. Cool? Ms. Sarno, what are the 4 muscles that move the temporal mandibular joint? Oh, you're muted. Can't hear you.
Masseter, temporal, and middle and lateral pterygoid.
Yeah, pterygoid.
Pterygoid.
Yeah, no P. I know there's a P there, but you don't say it. It's silent.
Okay.
You say
T. Middle and lateral pterygoid.
Yeah, that's awesome. Thank you, thank you. Very cool. All right, sounds good. Miss Estes, last call. You there? She gets sleepy this time. Oh, she's there! Oh, good. Miss Estes.
Yes.
What are
You
the
lose me for a moment.
What are the 4 muscles that affect the temporal mandibular joint? Move the temporal mandibular joint. Lots of stuff can affect it, but
I just spilled my water. Sorry.
that's okay.
Okay. We have the masseter and the temporal, and then the
Temporalis.
Terry,
Yeah.
what are they called? Pterygoids.
Yeah.
Medial and lateral.
Thank you. Thank you, Miss Estes.
Right.
Okay, everybody. Let's release homework. Let's see what we got going on here. Let's see. Okay, it's actually already released. So you've got a tiny little test on these muscles, and you've got a little assignment about the hyoids. And I think you've got time to feed them. Finish them both. Let's use our English today. So you've got 2 assignments, and you've got time right now, and I will be around. And so stay on here with me, do your homework, eat your vegetables, take your vitamins. Thank you.